Blood pressure is one of the most important human vital signs. Most of this pressure is due to work done by the heart by pumping blood through the circulatory system to vital human organs. When blood pressure gets too high, a condition called hypertension, it can lead to serious medical problems. Hypertension means a person's heart and arteries must work harder than they normally would, and over time, the added stress can damage them. When the heart and arteries don't work as well as they should, other body parts, like the kidneys, eyes, and brain, may suffer. Having high blood pressure makes people more likely to have heart failure, kidney failure, loss of vision, or even a stroke or heart attack.
Hi, my name is Dr. Joseph Young, and I'm a physician with Kaiser Permanente. I'm also the hypertension lead for the Northern California region. Hypertension is just the medical word for high blood pressure. So high blood pressure and hypertension mean the same things.
The American Heart Association guidelines for normal blood pressure are 120/80 or lower.
The top number is the pressure inside the blood vessel when the heart is pumping at its peak force. So the heart is pushing blood through the blood vessels, and at the peak, you get the highest pressure. Similarly, at some point, the heart rests because it has to fill up with blood again. And when the heart is resting, the pressure inside the blood vessel starts to drop and hits a low point. The way we actually measure the blood pressure is we inflate a cuff on the arm, and when the pressure in that cuff is higher than the blood pressure, then the blood stops flowing, temporarily, of course. As we let the air out of the cuff, the blood starts flowing again, and we can hear that pulsation through a stethoscope. Today, for the most part, we actually use machines that replicate that process. 29% of the U.S. adult population has high blood pressure. High blood pressure, hypertension, can cause damage to vital organs. It can cause strokes. It can damage the heart by causing heart failure and heart attacks. And it can damage the kidneys and lead to kidney failure and even the need to be hooked up to an artificial kidney machine, a process that is known as dialysis. So it's very important that we recognize high blood pressure and treat it because it's very treatable. And if we treat it, we can prevent those costly complications. And not only can we free up money for better uses than treating complications of a very treatable disease, but more importantly, we can improve the health of people with high blood pressure. And as we make the individuals in our community healthier, the community as a whole is also going to be healthier. So what is it that a physician has to consider when treating patients with high blood pressure? Well, the first thing is, does the patient know why this is important? It has to be more than just a number. It has to correlate to the patient's sense of well-being. The next question is, does the patient's family, the patient's friends, and the patient's loved ones, do they all understand what high blood pressure is about? We can't make changes in our lives if the people around us don't understand why it's important and don't support us. So that's the second factor. The next thing is physicians, I think, need to motivate, not frighten patients. I think it's really important that the patient not so much worry about what the complications of untreated hypertension are, but rather know what the benefits of treating hypertension that the patient understand that treating hypertension is going to lead to a healthier life, that it's going to lead to a fuller life, and that a better quality of life. So 2 questions that I'd like to pose for you today. First revolves around a patient. Imagine that you're seeing a patient in clinic, you're the physician, the patient has an elevated blood pressure. You talk to the patient, you find out that the patient does not exercise regularly and eats at fast food restaurants 4 or 5 times a week. What would your strategy be to get that patient's blood pressure under better control? The second question relates to patients that are not in front of you. You know that many patients in the community as a whole have high blood pressure, and they're not all coming in to see the doctor. What strategies might you employ to try to get their blood pressures under better control?
Here's your challenge. As a physician, what would you do for a patient that visits you with high blood pressure? What would you do to help community members who are not seeing physicians? As you solve this problem, you'll need to consider the following constraints. Risk factors for people with hypertension. effective diet on hypertension, effective physical activity on hypertension.
There are a number of factors that go into the development of high blood pressure. First of all, genetics and family history can play a role. So hypertension is more common in certain ethnicities, and it's certainly more common in families where multiple members have high blood pressure. Lifestyle and environmental factors play a very important role in the development of high blood pressure. Let's talk a little bit about diet. A diet that is rich in fruits and vegetables is going to be very healthy. It's rich in potassium and it's low in sodium. Potassium is good. It helps to prevent high blood pressure. Sodium is bad. It raises blood pressure. Exercise is another very important factor to consider. Exercise is very important for our overall health. It's very important for our sense of well-being. We talk about 150 minutes a week of aerobic exercise. That could be 30 minutes 5 times a week or divide it up any way you want, but the magic number is 150 minutes a week. So you've had a chance to think about the patient who has high blood pressure. Did you consider lifestyle changes? Did you work with a patient to try to encourage the patient to exercise more regularly? Did you work with a patient to eat less fast food and to eat more unprocessed food and to eat more fruits and vegetables? And did you motivate the patient? Did you make it clear to the patient why they're doing this? That you're not just trying to make the numbers look better, but you're actually trying to change the patient's health in a positive way that will keep them healthy and living a full life long into the future. If you made these lifestyle changes with the patient, and if the patient's blood pressure still didn't come down to goal after a few months, did you consider treating with medication? So we've talked about taking care of that patient in front of you, that patient with high blood pressure. But what about the patient with high blood pressure that doesn't come in? We know that there's lots of patients who have high blood pressure who don't come in regularly for office visits. At Kaiser Permanente, we've developed a registry which is based on use of blood pressure medications. It's based on having had a diagnosis of high blood pressure, and it's also based on elevated blood pressure readings, even if a diagnosis of hypertension hasn't yet been made. And using that registry, we can improve the health of our entire population by making sure that folks that have high blood pressure are getting treated. We reach out to those folks and we make efforts to make sure that even though they may not be thinking about high blood pressure, that they are getting this problem addressed. Within Kaiser Permanente, over the last decade or so, we've seen our stroke rate fall by 42%. We've seen the percentage of heart attacks drop by 24%, and we've seen the percentage of the worst kind of heart attacks drop by 62%. And because we've been so successful at controlling high blood pressure, we've wanted to share that model outside of our own walls. And so through our community benefits department, we've shared technical expertise, physician expertise, funding, and resources with community clinics, expanding the reach that this process has so that more patients can benefit. Much as we know about implementing an effective program to treat high blood pressure, it's also true that there are still questions that we don't have the answers to. We have a very active division of research at Kaiser Permanente which helps us to address some of those questions.
How did your solution compare to Dr. Young's solution? If you liked solving this challenge, you might want to consider one of the following careers: family physician, cardiologist, internist, or preventive medicine specialist. People throughout the healthcare field, like Dr. Young, work together to keep society healthy. How did he identify his personal interests and develop the required skills to pursue a rewarding career?
My job's about helping people. I come to work and the challenges that I face are finding solutions for people to improve their health. That gives me a tremendous sense of well-being, and I can't imagine anything more rewarding than that. I've always gravitated toward the sciences. I've always enjoyed the sciences. And the realization that I had when I was in college as an undergraduate was that medicine was an opportunity to implement scientific knowledge in a very practical way, and that really appealed to me. And so that's how I chose medicine.
Medical professionals often hone an early interest in biology, chemistry, and other sciences beginning with high school courses.
I want to share with you a personal story from my own family. My grandmother had high blood pressure. She suffered a series of strokes in her 70s and eventually died in her late 70s. Had she been born a generation later, she would have had access to today's medical care. I have no doubt that with today's care, her blood pressure would have been well controlled, and she would not have had those strokes. She would have lived a longer, fuller, and a healthier life. So my challenge to you is pursue your education, find out what's out there, and make a contribution to the community around you. Find the thing that really gets you excited, the thing that really motivates you, and pursue it. You're going to have challenges along the way, but you're also going to have opportunities. Stick with it, stay focused, advance your education.
A career as a medical doctor usually begins with an undergraduate degree in biology, physics, chemistry, or mathematics. Students then will apply to medical school. Medical school programs are generally 4-year programs. After graduating from medical school, future physicians begin a residency program. A residency can last anywhere from 3 to 7 years. Medical doctors are supported by other healthcare professionals like registered nurses, medical laboratory technicians, respiratory therapists, and ultrasound technicians.
And as you pursue your education and as you pursue your future careers, take care of yourselves, live healthy lives, exercise regularly, eat well, eat your fruits and vegetables. That will serve you well, and it will be a model to those around you.